Welcome, beautiful mama. If you're 34 weeks pregnant, take a deep breath with me right now. Your baby is growing strong, protected, and learning important skills inside your womb. And today, I'm here to walk you through this week with calm, clarity, and confidence. At 34 weeks, your baby is not in a rush. They're simply fine-tuning their lungs, practicing feeding, and preparing gently for life outside. Many of the changes you're feeling are normal, expected, and part of a healthy pregnancy journey. So, stay with me. Because in this video, I'll explain what's happening with your baby, what's happening in your body, and which signs deserve attention without fear, without panic, just information you can trust. Before we begin, take a second to like this video. It helps us reach more expecting parents, and subscribe to the channel so you don't miss the next weeks of this beautiful week-by-week pregnancy. And tell me in the comments, I'm here at 34 weeks, or how many weeks pregnant you are. Let's go through this journey together. At 34 weeks, your baby is strong, growing steadily, and getting ready for life. Outside, most changes now are finishing touches, not catching up. At 34 weeks of pregnancy, it is important for you to know that your baby is no longer fragile or behind. At this stage, your baby has already completed the most critical phases of formation. What happens now is refinement, maturation, and preparation for life outside the womb, which can be deeply reassuring for expecting parents. Many parents feel anxious in the final week because everything starts to feel more intense, stronger movement, heavier belly, more physical discomfort. But medically and biologically speaking, your baby is already strong and capable. Each day inside the womb is a bonus, allowing organs to become more efficient and coordinated. This period is often described as a phase of polishing. The body systems your baby already has are learning to work together. Breathing movements, swallowing, and sucking are practiced daily, even though birth has not yet happened. Understanding that your baby is not racing against time, but calmly preparing can help reduce fear and replace it with confidence. Your body and your baby are working together in a natural, intelligent rhythm. By 34 weeks, your baby's nervous system is more organized, allowing for better control of movements and responses. This is why movements may feel stronger yet more limited in range. There is less space, but more purpose behind every motion. Your baby is spending more time resting and sleeping, which is a healthy sign of neurological maturity. Sleep cycles are forming, and brain connections are strengthening every day. This is essential for learning, memory, and regulation after birth. While growth continues, it is slower than in earlier weeks, which is completely normal. Instead of rapid lengthening, your baby is focusing on gaining weight and building fat stores. These fat layers help regulate body temperature once your baby is born. Knowing that your baby's body is prioritizing function over speed can bring peace. Growth is not about size alone, it's about readiness. One of the most important developments at 34 weeks is lung preparation. Although your baby's lungs are still filled with amniotic fluid, they are practicing breathing movements constantly. These movements strengthen the muscles needed for breathing after birth. Inside the lungs, surfactant production continues to. Surfactant is a substance that prevents the air sacs from collapsing, making breathing easier once your baby takes their first breath. This process is gradual and improves daily. This means that even if a baby were born at this stage, medical teams are often able to support breathing very effectively. Each additional day inside the womb further reduces the risk of respiratory complications. Understanding this can relieve fears about prematurity. Your baby is not unprepared, just still perfecting an already impressive. At this stage, your baby is also practicing feeding behavior. Swallowing amniotic fluid helps prepare the digestive for milk digestion. This is an early form of training for breastfeeding or bottle feed. The stomach and intestines are learning how to move, digest, and absorb nutrients. This internal practice is silent and unseen, but incredibly important for life after birth. Your baby's sucking reflex is becoming stronger and more coordinated. This reflex will later help your baby latch and feed effectively. These small, repetitive movements now build confidence later. Knowing that your baby is learning before birth can be comforting. Your baby is not starting from zero. They are already practicing. By 34 weeks, your baby's immune system is also developing rapidly. Antibodies from your body are crossing the placenta, offering protection that will last through the first months of life. This natural transfer of immunity is one of the reasons doctors encourage babies to remain in the womb as long as it is safe. Each extra day strengthens this protective. Your baby's skin is becoming thicker and less transparent, helping to protect against fluid loss and temperature changes after birth. The Vernix continues to play a protective role during this time. These invisible processes show how wisely designed pregnancy. Even without conscious effort, your body is giving your baby exactly what they need. Emotionally, many parents feel torn between excitement and exhaustion at 34 weeks. This emotional shift is normal and mirrors your baby's own transition from growth to readiness. Your baby can now respond more clearly to light, sound, and touch. Pupils react to light filtering through the womb, and familiar voices may bring comfort. These sensory experiences help your baby begin bonding even before birth. Your voice, your heartbeat, and your movements create a familiar world. This connection can be deeply reassuring. You are already your baby's safe place. Although space is limited, your baby continues to move regularly. These movements may feel slower or more rolling than sharp kicks, which is expected at this stage. What matters most is not strength. Regular movement is a sign of well-being and healthy neurological function. Being aware of your baby's usual movement pattern helps you recognize what is normal for them. This awareness empowers you to trust your instinct. You don't need to panic over every change. Just stay attentive and calm. Physically, your baby's body is now well proportioned. Head size, limb length, and torso are aligning closer to how they will look at birth. Bones are still soft and flexible, which is essential for passing through the birth canal. This flexibility is intentional and your baby's muscles are stronger now, helping with posture and positioning. Many babies settle into a head-down position around this time. Everything is quietly aligning for birth, without rush, without pressure. This week represents stability. Major organs are formed, systems are functioning, and daily changes are about efficiency, not survival. Your baby is not waiting passively. They are actively preparing in ways science continues to study and admire. Each breath practice, each swallow, each sleep cycle is a step toward independence. Understanding this can replace fear with respect for the process unfolding inside you. At 34 weeks, the message is simple yet powerful. Your baby is doing well. Growth is steady. Development is intentional, and preparation is ongoing. Nothing needs to be rushed. Your baby knows what to do. Trust your body, trust the process, and trust your baby's ability to grow at their own perfect. You are not just approaching the end of pregnancy, you are approaching readiness. Your baby's size and weight at 34 weeks are within healthy ranges, and variations are normal and expected. At 34 weeks of pregnancy, many parents become very focused on numbers, length, weight, percentiles. While these measurements are used, they are not a verdict on your baby's health. They are estimates, not exact definitions of how your baby should. Your baby's size at this stage usually reflects genetics, placental efficiency, and natural growth rhythm. Just like adults, babies come in different shapes and sizes, even before birth. Ultrasound measurements have a margin of error, especially in the third trimester. This means small differences in numbers are often normal and not a cause for concern. Understanding this helps reduce comparison and anxiety. Your baby is growing according to their blueprint, not a universal mold. Weight gain at this stage is mainly about fat accumulation. This fat is not excessive, is essential for temperature regulation and energy after birth. Your baby is learning how to store energy, which will help them adjust to feeding cycles and sleeping patterns once they are born. Some babies gain weight faster, others more slowly, and both patterns can be healthy. Doctors look at trends over time, not a single measurement. Consistency matters more than speed. A steady curve is usually more reassuring than a rapid. Length growth slows down now, which is completely expected. Earlier in pregnancy, length increased rapidly, but now the focus shifts to strengthening and refining. Your baby's bones are lengthened enough. What they need now is flexibility and resilience. This flexibility helps during birth. The curled position inside the womb can also affect how length is estimated, making babies appear shorter on skin. This is another reminder that numbers never tell the whole story. At 34 weeks, your baby weighs around 2 kilograms on average, but healthy babies can weigh more or less. This variation alone does not predict outcome. Doctors evaluate weight alongside fluid levels, placental health, movement, and heart rate. Growth is a multi-factor picture. As long as your baby is receiving nutrients and oxygen effective, growth will continue at the right pace. Your body is doing its job, feeding and supporting your baby. Comparing your baby to others' friends, social media, or even siblings can increase unnecessary worry. Every pregnancy is unique, even within the same family. Different pregnancies can have different growth patterns. Trust the medical follow-up you are receiving. Prenatal care exists to monitor trends, not perfection. Peace often comes when you release comparison and focus on connection. Your baby's weight also reflects how well the placenta is functioning. At this stage, the placenta is still highly active and efficient. As long as blood flow and nutrient exchange are good, growth remains healthy. This is why doctors monitor blood pressure and movement. These signs help confirm placental well-being. Healthy growth is supported by healthy monitoring, not constant worry. Your nutrition still matters, but drastic changes are unnecessary. Balanced meals and hydration are enough. Your baby takes what they need first. Your body is designed to prioritize fetal needs. Stress reduction also plays a role in growth, influencing hormones and blood flow. Calm is not just emotional, it's physiological. Some babies are born smaller and thrive. Others are larger and still need support. Size alone does not define strength. Your baby's resilience is built from many systems working together. Growth is about readiness, not just measurement. And readiness looks different for every baby. Your baby's growth is ongoing and dynamic. What matters is direction, not exact position on a chart. Doctors are trained to intervene only when patterns suggest risk. If no concern has been raised, that silence is meaningful. It often means everything is progressing as expected. At 34 weeks, trust that your baby's size reflects a healthy process. There is room for variation, room for individuality, and room for confidence. Your baby does not need to match anyone else. They only need to continue growing with. Your baby is practicing breathing, sucking, and swallowing essential skills for life after birth. Even before birth, your baby is actively preparing for survival outside the womb. These preparations are subtle but powerful. Breathing movements happen daily, even though air is not yet involved. This strengthens respiratory muscle. Swallowing amniotic fluid helps train coordination between muscles and nerves. These practices happen naturally, without effort from. The lungs are filled with fluid now, which is normal and protected. This fluid will clear at birth. Your baby's brain is coordinating breathing rhythms, preparing for independent respiration. Surfactant production continues, helping air sacs stay open after birth. This biological preparation is one of the greatest reassurances. Sucking movements help develop facial muscles and reflexes. This reflex is critical for feeding and bonding after birth. Babies who practice sucking in utero often transition more feeding. Practice now builds confidence later. Swallowing fluid also helps the digestive system. The stomach and intestines are learning to move rhythmically. This prepares your baby for digesting milk efficiently. Your baby's body is rehearsing life. These movements also stimulate brain development. Neural pathways strengthen through repetition. This coordination supports feeding, breathing, and calming. Preparation is happening at every level. You may notice rhythmic movements or patterns. These are signs of practice. These movements are purposeful, not random. Your baby is learning through repetition. Growth is active, not passive. Your role is simply to nourish and rest. Your body supports this learning automatically. You do not need to intervene or worry. Nature is doing the teaching. Even premature babies benefit from this early practice. Every extra day inside the womb enhances coordination. Time is an ally at this stage. Your baby is using it wisely. These skills help with smoother transitions after birth. They support feeding, oxygenation, and comfort. Your baby is not unprepared. They are rehearsed. At 34 weeks, your baby is already learning how to live. Each breath practice is a step forward. Each swallow is preparation. Your baby is becoming ready. Changes in movement are normal. Now what matters is regular activity, not strength or space. As your baby grows, space inside the uterus becomes limited. Movements may feel slower, deeper, or more rolling. This change is expected and normal. Less space does not mean less well-being. Your baby still moves regularly, just differently. Kicks may become stretches or turns. Strength is replaced by intention. Movement evolves with growth. What matters most is consistency. Knowing your baby's usual pattern helps you recognize changes. This awareness empowers you. You are the best observer. Daily movement confirms neurological. It reflects oxygen and nutrient delivery. Movement is communication. Your baby is checking in with you. Quiet moments can happen during sleep cycles. Babies sleep more at this stage. Stillness can be normal. Timing matters. When in doubt, focus and observe. Choose a calm moment and feel. Trust your intuition and seek care if something feels off. Doctors recommend monitoring, not obsessing. Simple awareness is enough. You do not need constant counting, just familiarity. Movement reassures both body and mind. It connects you to your baby. It builds trust. It strengthens bonding. Reduced space means stronger sensations when movement happens. These sensations can be comforting. They are signs of presence. Your baby is there. At 34 weeks, movement changes are normal. Consistency is the key signal. Your baby is adapting, and so are you. Light pregnancy body changes are common and manageable, and most discomforts are not signs of danger. Your body is under physical pressure now. The uterus occupies much of your abdomen. Organs shift to accommodate your baby. Discomfort does not mean something is wrong. Frequent urination happens due to bladder compression. Leakage can occur with coughing or laughing. This is common and temporary. Your body is responding to anatomy. Heartburn increases as the stomach is pushed upward. Digestion slows. Small adjustments can bring relief. Comfort is possible. Shortness of breath can happen. Your diaphragm is compressed. This improves when the baby descends. Relief is ahead. Fatigue reflects energy redistribution. Your body works constantly. Rest is productive. It is not laziness. Headaches may occur from dehydration or tension. They deserve attention. Persistent pain should be evaluated. Listening matters. Swelling can increase late in pregnancy. Gradual swelling is common. Sudden swelling requires care. Awareness is protective. Your body communicates through sensation. Most are adaptive. Some are signals. Learning the difference brings confidence. Prenatal care exists to guide and reassure. Use it as support. You are not alone. Monitoring brings safety. At 34 weeks, your body is doing intense work. Discomfort does not equal danger. Support, rest, and knowledge help. You are capable and strong. Vernix and amniotic fluid play an important role in protecting your baby and preparing their skin and digestion. At 34 weeks, your baby is still covered, at least partially, by a creamy white substance called Vernix. This coating is completely natural and serves several protective purposes during late pregnancy. Vernix acts as a barrier between your baby's delicate skin and the amniotic fluid. Without it, constant exposure to fluid could irritate or dry the skin. This protective layer helps your baby maintain healthy skin integrity, which will be essential after birth when the environment suddenly changes. Knowing that your baby is well protected can bring reassurance during these final weeks. Vernix also plays an important role during birth. It helps your baby move more easily through the birth canal. This natural lubrication reduces friction and supports a smoother transition during delivery. It is another example of how the body prepares both mother and baby for birth without conscious effort. Nothing about this process is accidental, is beautifully. Around this time, Vernix may begin to shed slowly into the amniotic fluid. This is a normal and healthy process. Your baby swallows small amounts of amniotic fluid daily, including traces of Vernix. This swallowing helps prepare the digestive system for milk digestion after birth. Your baby is practicing digestion long before the first. Scientists believe this swallowing may help test the gastrointestinal tract. The stomach and intestines learn how to move, absorb, and process substance. This preparation supports smoother digestion in the newborn period. Learning begins earlier than most people imagine. Amniotic fluid itself plays a vital role in development. It cushions your baby and allows safe movement. It also helps regulate temperature and protect against infection. Your baby interacts with this fluid, constantly breathing, swallowing, and moving within it. The womb is a dynamic environment. not a passive. The composition of amniotic fluid changes over time, adapting to your baby's needs. It contains nutrients, hormones, and immune factors. This fluid supports growth while also stimulating development. Your body adjusts continuously to support your baby. Late in pregnancy, the balance between Vernix and fluid continues to evolve. Some babies are born with more Vernix, others with less. Both are normal and healthy variation. There is no right amount. After birth, traces of Vernix often remain on the baby's. Many healthcare providers encourage leaving it in place for a while. It continues to protect and moisturize the skin after birth. Nature's protection does not end at delivery. Understanding Vernix helps parents feel more comfortable with their baby's appearance at birth. That creamy coating is not dirt or infection. It is protection, preparation, and care. It is part of healthy development. At 34 weeks, Vernix and amniotic fluid are working together. They protect, prepare, and support your baby. These unseen systems are active every day. Your baby is well cared for inside you. Frequent urination and mild incontinence are common late pregnancy effects caused by your baby's position. As your baby grows, their head often moves downward into a head-down position. This position places pressure directly on the bladder. As a result, you may feel the urge to urinate more often. This is mechanical, not a failure of your body. The bladder physically holds less urine now because of this pressure. Even small amounts of urine can trigger the urge to go. This explains frequent bathroom trips. It is a normal anatomical. Mild urine leakage can happen when cough, sneeze, laugh, or move suddenly. This is called stress incontinence. It affects many pregnant people, especially in late pregnancy. You are not alone in this experience. Hormonal changes also relax the pelvic floor muscle. These muscles will recover after birth with time and support. Pregnancy temporarily alters muscle. Recovery is expected. Limiting fluids does not solve this problem and can create others. Hydration is essential for kidney function and infection prevention. Drinking enough water protects both you and your baby. Bathroom trips are inconvenient but beneficial. Going to the bathroom as soon as you feel the urge helps prevent discomfort. Leaning slightly forward while urinating can help empty the bladder more fully. Small adjustments can make a difference. Comfort is achievable. Being aware of urinary infection symptoms is important. Burning, pain, fever, or cloudy urine should be evaluated. Infections can increase pregnancy. Early care is protective. Most bladder-related symptoms resolve after delivery. As pressure decreases, bladder capacity returns. Pelvic floor strength improves gradually. This phase is temporary. Using protective pads if needed can reduce stress and embarrassment. There is no shame in adapting. Comfort and confidence matter. You deserve both. At 34 weeks, bladder changes are expected. They reflect your baby's position and growth. They do not mean something is wrong. They mean your body is adapting. Heartburn and digestive discomfort increase late in pregnancy due to physical pressure, not poor digestion. As the uterus expands, it pushes upward against the stomach. This pressure can slow digestion. Food stays in the stomach longer. Discomfort can follow. Heartburn is caused by stomach acid moving upward. Hormones also relax the valve between the stomach and esophagus. This combination makes heartburn more likely. It is not dangerous, just uncomfortable. Eating smaller meals helps reduce pressure. Avoiding large drinks with meals can also help. Simple changes often bring relief. You do not need drastic restriction. Lying down immediately after eating can worsen symptoms. Staying upright helps gravity work in your favor. Resting on your left side can reduce acid reflux. Position matters. Spicy, fatty, or acidic foods may trigger symptoms. Identifying personal triggers is helpful. There is no universal rule. Your body gives feedback. Heartburn does not harm your baby. It does not affect nutrient delivery. It reflects space constraints, not health problems. Your baby is safe. As the baby descends into the pelvis, pressure often decreases. Many people notice relief around 36 weeks. This change can feel sudden and welcome. Relief is ahead. Persistent or severe pain should still be discussed with a provider, especially if accompanied by other symptoms. Listening to your body is important. Comfort and safety go together. Managing heartburn is about support, not endurance. You do not need to push through discomfort. Small changes can help significantly. Care includes comfort. At 34 weeks, digestive discomfort is common. It reflects growth and positioning. It is temporary, and it will ease. Persistent headaches and certain symptoms can signal high blood pressure and should never be ignored. Headaches can have many causes during pregnancy. Fatigue, dehydration, and tension are common triggers. Most headaches are not dangerous, but some require attention. A headache that does not improve with rest or hydration is concerning, especially if it is severe or throbbing. Persistent pain deserves evaluation. Your comfort matters. Vision changes are an important warning sign. Seeing flashing lights, spots, or blurred vision is not normal. These symptoms may indicate high blood pressure. They require prompt care. Sudden swelling of hands, face, or feet can also be a sign. Rapid swelling is more concerning than gradual swelling. Pay attention to changes. Your awareness protects you. Upper abdominal pain, nausea, or chest discomfort should be reported. These symptoms can be subtle. They are sometimes overlooked. They should not be ignored. Preeclampsia can develop quickly and silently. Regular blood pressure checks are essential. Prenatal care is preventive care. Monitoring saves lives. Certain factors increase risk, but anyone can develop preeclampsia. First pregnancy, multiple pregnancies, and chronic conditions increase risk. Awareness matters for everyone. No one is exempt. Early detection allows for safe management. Treatment protects both parent and baby. Ignoring symptoms increases risk. Acting early reduces complications. Trust your instinct. If something feels wrong, seek. You are not overreacting. You are protecting yourself. At 34 weeks, vigilance is an act of paying attention is strength. Care is not fear. Care is wisdom. Prenatal monitoring, vaccines, and late pregnancy tests help protect both you and your baby. Late pregnancy includes important routine care. Prenatal visits often become more frequent. This increased monitoring is intentional. It ensures safety. Listening to your baby's heartbeat provides reassurance. Simple tools can confirm well-being. Technology supports connection. Care is collaborative. The Tdap vaccine is recommended during pregnancy. It protects against tetanus, diphtheria, and pertussis. This protection transfers to your baby. Vaccination is preventive care. The ideal window for Tdap is between 27 and 36 weeks. If you haven't received it yet, discuss it with your provider. Timing matters. Protection begins before birth. The Group B strep test is usually done between 35 and 37 weeks. It screens for a common bacteria. It is harmless to adults, but important for newborn safety. A positive test does not mean illness. It simply guides care during labor. Antibiotics during labor prevent transmission. Prevention is effective. Knowing what tests are coming reduces anxiety. Information replaces preparation, builds confidence. You deserve clarity. Prenatal care adapts as birth approaches. Focus shifts from growth to readiness. Monitoring increases support, not control. Each appointment is a checkpoint of reassurance. Silence often means things are going well. Consistency builds trust. Trust supports. At 34 weeks, care is about protection. Every test has a purpose. Every visit supports safety. You and your baby are being cared for.